Unlinked cases here are on the rise as Singapore battles a growing COVID-19 outbreak. The highest number of such cases this year has been logged. There are 52 unlinked cases out of the 162 locally transmitted infections. And one expert says that the numbers show how transmissible the Delta variant is.
For the unlinked cases, it is basically a signal. And that signal is to remind us that Delta virus or the SARS-CoV-2 virus is still with us. It is still in our environment. It is still being carried by some infected individuals. And therefore, it tells us that we need to be even extra careful. Don't let our guard down. This is not the time.
Of the 110 linked cases, 59 were already on quarantine, while 51 were detected through surveillance. 87 are linked to the Jurong Fishery Port cluster, while 5 have been traced to the KTV cluster. The Health Ministry says that 6 cases are seniors who are partially or not vaccinated and are at risk of serious illness. The number of seniors at risk has been rising for the past 3 days. There are also 8 imported cases. All had been placed on stay-home notice or isolated upon arrival. 5 were detected upon reaching here. 3 developed the illness later. The national tally now is 63,791. As Singapore's COVID-19 cases continue to surge, there's another call for people to get vaccinated. New data from the National Centre for Infectious Diseases shows that the majority of patients this year are infected with the Delta variant. And for those not fully vaccinated, well, the proportion who are seriously ill is much higher. 1,165 unvaccinated patients were admitted to NCID. That was from February to December last year, before vaccinations started here in Singapore. Now, that data was used to compare against 328 patients admitted from April to June this year. Among them, 192 unvaccinated, 38 partially vaccinated, and 98 fully vaccinated. The majority of NCID's patients this year were infected with the Delta variant. The disease was more severe in patients aged 50 and above who weren't fully vaccinated. 33% of them this year needed oxygen support. That was compared to 13.6% last year, before the variant started spreading widely.
We know that age is a significant effect, so we want to look at different age group. So when we look at our data, in fact, by the time you look at 50 years old, we can already see a difference. For those individuals vaccinated, the disease severity reduced significantly, even among the older individuals.
Among this year's patients aged 50 and above, NCID also saw that the proportion of them who needed oxygen support was highest in the unvaccinated group at 41.8%. That's compared to 11% of patients partially unvaccinated and 1.7% of those fully vaccinated. The data has led to NCID reinforcing the call for everyone to get their shots.
If you look at today's, we have already given more than 6 million doses of vaccine. We have adequate information and understandings that, in fact, the vaccines is very, very safe.
Singapore is also calling out to the youth to help persuade seniors in their families to get vaccinated. They could play an important role in educating seniors about the vaccines. This was raised during a discussion for youths on social media platform TikTok.
Some of them might be afraid of getting vaccinated because of the potential side effects. And we have to explain to them. And very often it's difficult when, let's say the government or experts come forward to say these things. It's very important, in fact, for family members, loved ones, friends to come forward and say these things.